Hi, you are watching COVID updates on Voice of Canada, and this is Sana Haroon. The Restrictions Exemption Program allows businesses and venues to operate without capacity limits and other public health measures if they require proof of vaccination or a negative test result from anyone entering.
2 months ago, as Alberta began its Open for Summer plan, Grant Humphrey got some bad news.
I received the word the beginning of July that I had a growth on my lung.
It was cancer, stage 3. His right lung so full of the disease, it was scheduled to be removed this week. But on Friday, the surgery was postponed indefinitely. When I asked what waiting could mean for his prognosis, Humphrey struggled to find the words.
Good question, Heather. I didn't have the guts to ask her.
Alberta hospitals are now so overrun with COVID-19 patients, every scheduled surgery has been postponed. Almost 150 intensive care beds have been added across the province, but in just a matter of days, those ICU beds are expected to be filled too.
There's something that simply doesn't add up. We've recognized the healthcare system cannot continue, and yet, for whatever reason, we've approached it with a lighter touch than we did in Wave 2 and Wave 3.
There are already problems with the province's restriction exemption program.
We're also seeing concerns about the cards themselves being editable and thus forgeable.
It's just so overwhelmingly disappointing on so many fronts.
Business owner Sarah Elder Chamanara learned over the weekend retail shops like hers are ineligible for the program and will not be required to ask customers for proof of vaccination. But as a mother who is also waiting for surgery,
When I see someone come in the front door, I will be asking for proof of vaccination.
there has been good news. Since the restriction exemption program was announced, vaccination appointments have risen by 300%. But the newly dosed won't have immunity for weeks. And for Alberta's health system and patients like Grant Humphrey,
An advisory committee for the U.S. Food and Drug Administration recommended giving booster shots for those aged 65 years and older, as well as those who run a high risk for severe diseases. But the panel also shut down a plan to give the extra dose for most Americans aged 16 and older based on data they currently have.
View the safety and effectiveness data from the clinical trial support approval of the Comirnaty booster dose administered at least 6 months after completion of the primary series for use in individuals 16 years of age and older.
Thank you. And Mike, can we pull up the voting pod? Okay, we have the voting pod up, so go ahead and cast your votes this time, please.
Jacqueline announced when the voting is to be done.
Yes, we're still getting votes in, so we've got about a minute remaining for individuals to cast their votes. Okay, it looks like we've received all of the votes. Let me read them aloud for the record. There should be 18 total votes today. Dr. Cohn has a no vote.
We have 19 here in the pod.
Right, we will figure out where the additional vote came in. So if we can close the poll, I'm going to read the votes aloud. Dr. Cohn voted no. Dr. Portnoy voted yes. Dr. Lee voted no. We did have an accidental vote from a speaker, so that will be disregarded. Dr. Chatterjee voted no. Dr. Perlman voted no. Dr. Gans voted no. Dr. Meisner voted no. Dr. Levy voted no. Dr. Hildreth voted no. Dr. Wharton voted no. Dr. Fuller voted no. Dr. Kurilla voted no. Dr. Monto voted no. Dr. McInnes voted no. Dr. Rubin voted no. Dr. Pergam voted no. Dr. Sawyer voted yes. Dr. Offit voted no. So this vote did not pass since the majority voted no. Thank you.
So do the known and potential risks outweigh the known and potential risks of the Pfizer-BioNTech vaccine booster dose administered at least 6 months after completion of the primary series for use in individuals 65 years of age and older and individuals of high risk at high risk of severe COVID-19.
Thank you, Dr.
Hello?
Monto.
Yep, we have it.
Okay.
So again, to all my members, please make sure you control your own muting. Please make sure you are muting yourself. All right, Kathleen Hayes, take it away.
Yeah, thank you, Mike and Dr. Monto. So same process as the first voting question. When you see the voting pod come up, please select yes, no, or abstain, and you will have 2 minutes. And just as a reminder, only voting members and temporary voting members can vote. Thank you. Go ahead. Okay, that was pretty quick. It looks like all of the votes are in. So we can close the poll, and we do have a unanimous 18 out of 18 who voted yes for this question. And I will read the votes aloud for the record. Dr. Cohn, yes. Dr. Portnoy, yes. Dr. Lee, yes. Dr. McInnes, yes. Dr. Perlman, yes. Dr. Gans, yes. Dr. Meisner, yes. Dr. Chatterjee, yes. Dr. Hildreth, yes. Dr. Wharton, yes. Dr. Fuller, yes. Dr. Kurilla, yes. Dr. Levy, yes. Dr. Offit, yes. Dr. Rubin, yes. Dr. Pergam, yes. Dr. Sawyer, yes. And Dr. Monto, yes. So thank you for your votes, and I will hand it back to Dr. Monto.
Alberta Premier Jason Carney has imposed pandemic protocols as COVID-19 patients inundate the province's hospitals and has offered an apology sort of for declaring the pandemic over too soon.
11 weeks after removing all public health restrictions, Alberta's open summer has come to an abrupt end.
We may run out of staffed intensive care beds within the next 10 days.
Facing a crisis in Alberta hospitals that could no longer be ignored, the Premier introduced broad new public health measures Wednesday. Alberta will no longer be wide open this fall. There are new restrictions on indoor social gatherings and for businesses, unless they opt into the restriction exemption program, Alberta's version of the vaccine passport. The Premier offered an apology of sorts.
I apologize for having embraced the public shift from pandemic to endemic, which was clearly premature. I don't apologize for having lifted public health restrictions in our Open for Summer plan.
But a summer without any restrictions has led Alberta into a crisis doctors have been trying to prevent. Former Alberta Chief Medical Officer of Health, Dr. James Talbot, says even with these measures, it's likely Alberta doctors will have to implement critical care triage protocols, ultimately deciding who will live and die.
The people who are going to have to make those decisions are going to be haunted by them for the rest of their lives, because they're going to have to face up with two things. One, they had to make the choice, and two, it was completely preventable.
Preventable, he says, if those in power had been listening.
One of the truly troubling things that happened in the province was that the Premier and some of his closest advisors were publicly sneering at Albertans who were trying to raise issues of public health.
A senior staff member in the Premier's office tweeted in early June, "The pandemic is ending, accept it." Now, on the brink of a healthcare disaster, the Alberta government has accepted that was wrong.
As the highly transmissible Delta variant spread even further, schools across several Canadian provinces are being forced to change pandemic tactics, despite efforts to keep in-person learning going as long as possible.
With COVID-19 cases now at 11 schools across the province, New Brunswick is changing its back-to-school plan.
Effective tomorrow, students of all ages in all schools across New Brunswick must wear a mask in school and while on school buses.
In Quebec, students in 72 schools will now be able to access rapid tests.
Those rapid tests are good, but they are complementary to regular tests, PCR regular tests. So if kids have some symptoms, we highly recommend parents to keep their kids at home.
The measure's designed to offer more layers of protection for students and their schools, especially as children under 12 remain ineligible for the COVID-19 vaccine. Children are less likely to become seriously ill from this virus, but some will. And in Alberta, where overall infection numbers are soaring, more kids are getting sick.
The numbers are rising. It used to be we would only see maybe 1 or 2 children presenting for emergency department care every week. And now we're seeing a handful of them almost every day.
With less support from the provincial government, Alberta school districts like the Calgary Board of Education are now doing things like contact tracing themselves. Though in a letter this week, parents were told that asymptomatic close contacts should keep coming to school. If you choose to keep your child at home, it will be marked as an unexcused absence.
It's really been contradictory in these statements of what we are wanting people to do, what we are asking them to do, and then how we're enforcing these provisions.
Creating confusion for parents in a dangerous time as the Delta variant continues to cause COVID-19 cases to rise.
British Prime Minister Boris Johnson announced the government was scrapping the plans for a mandatory COVID-19 vaccine passport system that would have been used in England for entry into nightclubs and other crowded events, though he cautioned it was not yet completely off the table.
Everybody, I want to set out our plan for managing COVID this autumn and winter, and I want you to cast your mind back exactly a year and think where we were last September as schools went back and the colder months approached, because in one way our position today is actually more challenging. We have higher levels of daily cases, thousands more, but in many other crucial respects, the British people, all of us collectively and individually, are incomparably better placed to fight the disease. We have more than 80% of all over 16s now double vaccinated, and we have COVID antibodies in around 90% of the adult population. And those vaccines are working. We've seen the extraordinary vaccine-induced falls in deaths and serious disease, and depending on your age, you're up to 9 times more likely to die, sadly, if you're unvaccinated than if you've had both jabs. And the result of this vaccination campaign is that we have one of the most free societies and one of the most open economies in Europe. And that's why we're now sticking with our strategy. In essence, we're going to keep going. We will continue to offer testing, and we'll continue to urge everyone to be sensible, to be responsible, wash your hands, use ventilation, consider wearing a face covering in crowded places with people that you don't know. Stay at home if you feel unwell. Download and use the app. And we're investing massively in our NHS to meet the pressures of COVID with an additional 5.4 billion in England over the next 6 months. And that's on top of almost 36 billion over the next 3 years to help our NHS recover and fix the long-standing problems of social care as well, as I was saying last week. And we're helping to vaccinate the world with 100 million doses for developing countries by next June. Well, I think this country should be proud, continue to be very proud, that the Oxford AstraZeneca vaccine remains the workhorse of global immunisation. And we will keep further measures in reserve. Plan B. We do not see the need now to proceed, for instance, with mandatory certification, but will continue to work with the many businesses that are getting ready such a scheme. Indeed, over 200 events have already used COVID certification voluntarily. And it's just not sensible to rule out completely this kind of option now, when we must face the fact that it might still make the difference between keeping businesses open at full capacity or not. We will also keep open the option of mandating face coverings as they have elsewhere, or advising people again to work from home, reflecting the fact that when you've got a large proportion of the country, as we have now, with immunity, then smaller changes can make a bigger difference and give us the confidence that we don't need to go back to the lockdowns of the past. And of course, we'll continue to update our advice to you based on the latest data. But in the meantime, we are confident in the vaccines that have made such a difference to our lives. And we're now intensifying that effort, offering jabs to 12 to 15-year-olds on the advice of the chief medical officers who've given that advice based on the health, well-being and educational prospects of the children themselves. And for over 50s and the under 50s who are at risk or more at risk, we're now motoring ahead with the booster program, a third dose 6 months after your second dose. And so that's going to mean we're going to be building even higher walls of immunisation, of vaccine protection in this country. And the UK government has procured at scale jabs for every part of the UK, and we'll be sending doses to the devolved administrations in Scotland, Wales and Northern Ireland. COVID is still out there. The disease, sadly, still remains a risk. But I'm confident that we can keep going with our plan to turn jabs into jobs, and protect the gains that we've made together. Thanks very much. I'm going to ask Chris, I think, to do the slides. Chris.
First slide, please. The first slide is the number of people testing positive for COVID-19 in the UK. As everybody, I think, knows, there was a significant dip during the middle part of the year. Started to rise in June and July. There was a peak which then eased off, but there's been a gradual drifting up over the last few weeks. It's stabilised over the last week, but I think we should be careful neither to overinterpret nor underinterpret this. At the moment, things have stabilised to some extent, but we are, as I'll come on to, going into a more difficult period of the year. Next slide, please. And the number of people in hospital with COVID has inevitably mirrored this. And what we've seen is, again, a gradual drifting up of the number of people in hospital. It is not anywhere near yet the point it was in the first peak and in the subsequent peaks at the early part, end of last year and the beginning of this year. But there is a gentle upward trend, variable around different parts of the country. Next slide, please. The good news, of course, is that the number of people who are dying following a positive test for COVID-19 is significantly lower, proportional to the number of cases, than it was at the end of last year and the beginning of this year. But these numbers, again, are not trivial by any means. Every one of these, of course, is a tragedy for the family. So around 140 deaths in terms of the 7-day average. And again, this is gradually drifting up, but very slowly. Broadly, this is flat to just drifting up. Next slide, please. And the number of people who've received a vaccination for COVID is also increasing, both for second doses, people who've previously been vaccinated getting their second dose to really strengthen their protection, and also for first doses. So those are the trends, and I think they've been widely circulated in various media outlets over the last few weeks, but that was just to bring people up to date. Next slide, please. We did, however, want to add just 3 additional slides because I think these make a point and reinforce the points that the Prime Minister has just made. This first slide, these are Public Health England data, shows the number of people with COVID-19 coming to emergency care within 28 days of a positive test. That just means with COVID in most cases. That led to a hospital admission by vaccination status. And what you can see is that in every age,
the United States has hit another milestone in the COVID-19 pandemic as 41 million people in the country have now contracted the virus. 16 states have also seen an increase in new cases over the past 2 weeks, as over 30% of Americans remain unvaccinated.
COVID-19 is still killing more than 1,500 Americans a day. The Centers for Disease Control says the risk of dying is 11 times higher for the unvaccinated. Doctors call these unnecessary deaths.
How quickly we get to a level where cases are low and stay low really depends on what we do collectively, not just the government, but each of us as private citizens.
We need to do more.
President Joe Biden declared war Thursday on over 30% of unvaccinated Americans, ordering millions of federal employees and contractors and healthcare workers to get vaccinated, and demanding large private employers mandate shots or require weekly testing.
The president really just made it very simple. This is a pandemic that we can end. The people who are blocking it can no longer be allowed to block it, period.
Already some Republicans are pushing back, saying the president has overstepped his powers, which will lead to more vaccine resistance. Many parts of the country are still locked in battles over mask and vaccine mandates.
The item passes.
Los Angeles schools are now requiring COVID-19 vaccines for students 12 and over, but some experts say expected legal challenges will likely fail since there are already laws mandating other vaccines for school children.
They stand on very firm legal grounds. It will be really difficult to challenge them, even though for a certain age group, some of these vaccines are only under emergency use approval.
The American Academy of Pediatrics says children now represent a quarter of all weekly COVID-19 cases. Vaccine makers are rushing to get emergency approval for vaccines for 5 to 11-year-olds. Some doctors believe those could be available by Halloween.
Anger is growing among Alberta's doctors as unvaccinated COVID-19 patients continue to overwhelm hospitals and their ICUs.
Alberta's doctors are angry.
It's very hard for me to even put into words what I'm feeling right now. We saw a complete abandonment of health and well-being for Albertans from the government.
Dr. Nija Bakshi is part of a group of doctors that have been holding regular COVID-19 briefings since late August. The physicians had hoped that a late Thursday announcement from Alberta Health would help bend the curve of what has become a punishing fourth wave. What the province announced was money for home care and a plan to move up to 200 acute care patients out of hospital and into long-term care next week.
I just want to stress right now that we're very concerned about our ICU capacity. That is our number one challenge and our number one issue.
And for that challenge, home care funding is unlikely to help. Despite adding more beds, Alberta's intensive care units are filling fast. At one point last week, there were just 9 beds available across the province. The last time the situation was this bad was back in May, but hospital numbers peaked after the province implemented sweeping restrictions, closing indoor and outdoor dining, fitness facilities, and moving K-12 classes online.
Now, nobody wants to see that again. Nobody wants to see restrictions. But the fact is, what we've done so far has not had any influence on viral spread. It continues to grow, and unless something changes, we can expect it to continue to grow.
Emergency medicine physician Dr. Joe Vipon says that is a terrifying thought.
That means physicians are going to have to make choices as to who gets that life-saving treatment of intensive care. And that means people will die who otherwise would not have died.
Last Friday, the province introduced a mask mandate for all indoor public spaces and a 10 o'clock curfew on liquor sales. The health minister says the province will wait to see if those measures have an impact before it does anything more. Heather, Eurex West Global News, Calgary.
Keep watching COVID updates on Voice of Canada. For further updates, visit our website voiceofcanada.tv.